Hi there, and welcome to the Holistic Pharmacy Podcast. I'm Dr. Jenna Carmichael. I am one of the co-hosts for this revamp of the Holistic Pharmacy Podcast, and I will be hosting moving forward our Journal Club section of the podcast. And I am so excited today to talk with Kari Coody about a multi-center, double-blind, randomized study of the lavender oil preparation Silexan in comparison to Lorazepam for generalized anxiety disorder. And I'm super excited to discuss this topic today. So Kari, I'm going to give you a little bit of background about you for our listeners today, and then we're just going to dive right in.
Sounds great.
So Kari Coody is a Christian, a wife, mom, integrative health practitioner, Pharm D, and co-host of Take the Upgrade podcast. She helps women prioritize their health as a real passion after seeing how broken the healthcare system is. She loves putting the pieces together and getting to the root cause of her clients' issues and walking on their journey with them. Kari's greatest role is being a wife to BJ and a mom to Edy and Cooper. Thank you so much, Kari, for being with us today.
Yes, I'm excited to dig in. I think this is a great topic we have and a great study we have to kind of look at, and hopefully it's going to be of value to the listeners and viewers.
Yes. The thing that actually surprised me the most when I was reading this study was that it was published in 2010. That's amazing.
I know, right? That's right. Yeah. Like where's this been? Right.
Right.
Exactly.
I thought that was really crazy to even think that we've had information like this. I'm an essential oiler. I kind of got into the whole holistic movement for myself, like through the foothold of essential oils. And I love to see that there's actual information and data. So I'm really, really excited to talk about this today.
Definitely. And thank goodness there's more and more every year, which is needed, obviously. So yep.
Yeah. So why don't you give us a little bit of background about this trial, kind of what makes this a little different than, say, the essential oil that you just grab at the health food store or something like that?
Yeah, sure. So I really wanted to pick this because I feel like it's important for people to have options. And we know that, especially when we think about anxiety and what drugs are typically prescribed, they have a lot of side effects that often people just learn to deal with because obviously they are helpful, of course, but the side effects come with it. So I'm thankful that now we have this laid out and that we have studies to prove that natural alternatives can be a great thing that are just as effective per this study result and have very little, if any, side effects. So to me, that's really exciting because I know so many people deal with anxiety in some way, shape, or form. And I was looking at a few statistics. I mean, it's estimated that 40 million people deal with anxiety, but I'm thinking it's probably much, much more than that. Those are just the ones that have actually been diagnosed with anxiety. But you just think about 2020 and 2021, who didn't deal with anxiety. So, needless to say, I do think it's a very important topic that, as pharmacists or healthcare professionals or, might have a mix listening to this podcast or video, but we need to be able to have different options to offer those that come to us and want, and need help.
I agree completely. I recently heard this concept of high functioning anxiety, and I'm like, oh, that's me.
Yeah, exactly. Like it's not bad enough to go to get something. Exactly. And that's such a good point because that's what I mean as far as I feel like it's a much bigger issue than we actually than it's documented, because so many are high functioning, but I just think about, okay, well, you're high functioning, it's not debilitating, but yet what are you really doing to your health? In the meantime, we know that there's just a lot of stress hormones that are circulating and what effect that can cause. So I think you hit the nail on the head with that.
Well, and I think that that's where this idea of lavender is so wonderful, right? Because you hear anxiety and, oh, lavender, go for lavender. It's relaxing. It has all of these lovely components in it. But, a lot of times we think of lavender as an aromatherapy. We're going to put it in our diffusers or we're going to put it on in our lotions and things. But to see a study that has internal use of lavender, I think is very interesting.
I agree with you on that. And that was definitely going to be something I wanted to touch on because I mean, obviously everybody who hasn't heard of lavender, right? It's scented, it's in scenting things. And we're just very familiar with that, that scent or that the name lavender as an essential oil and a scent. But I do feel like so many are very hesitant to even think about taking essential oils internally. And I definitely understand why. The quality just hasn't been there for a long time, to be able to warrant that. But now with just the focus on quality that a few companies have, I think it's definitely really the best way to use lavender for anxiety is internally. You can use it the other ways, and I'm not saying it won't be helpful, but if your body needs that much extra support for anxiety, I just think that internal use is going to be much more effective than using it aromatically or topically.
So yeah, so let's get into the to the meat of the study then. In terms of efficacy, I think that this is amazing that this is not a placebo controlled or lavender against placebo. This is lavender against a benzodiazepine against Lorazepam. So tell me about this. What did this study? Tell me about this study. How they kind of looked at it, and I'm just really interested in this.
Yeah, sure. Well, let's dive in. Like you said, I mean, it's when we hear about studies, it's got all the kind of bells and whistles, right? It's multi-centered, it's double blind, it's randomized, like all those things that you kind of want to have in place for it to be a true trial with great outcomes, let's say. But it was a 6-week clinical study where they did perform and evaluate really the efficacy of Silexan, which is an internal lavender, against benzodiazepine, which they chose Lorazepam. And they wanted to specifically target those that have been diagnosed with generalized anxiety disorder. And they used something called the Hamilton Anxiety Rating Scale to really measure as an objective measurement of the severity of the anxiety, obviously at baseline, and then again at 6 weeks. And so they took these two different groups of people. Obviously, one was on Lorazepam and the other was on this oral form of lavender. And just really had feedback from them all throughout the study. And then, of course, use this scale to see, okay, how are you doing at the beginning? And then how are you doing at the end of the trial? And I think it was just amazing that they deduced that the lavender really had no sedative effects, whereas the Lorazepam, of course, we know it's pretty known for that. So to me, that was a huge win, and just that the efficacy was there in this trial.
Yeah, I was really surprised to see that when they were looking at this and this rating scale that you see that okay, the decrease in anxiety of the Lorazepam compared to the lavender was essentially the same, which I think is amazing. So here we're now saying that in a randomized double-blind controlled study, we have seen that lavender essential oil taken internally is just as good when we're talking about anxiety compared to a benzodiazepine, which I think is mind blowing, right? Because I don't think I would have ever seen this study. I don't think that this study would have ever existed. And I think that's amazing. I'm so excited that this study exists.
Definitely. And you know what it makes me kind of think of is, and everybody maybe has a different perception when they think about essential oils, but most of the time people think about them as a nice smell, as something that you might use in conjunction with something else. Oh, you're going to need to be on this, but you can use this also, not necessarily taking into account the actual real benefits that they can have for something that's maybe a little bit more progressed of a type disorder, or, something that you would think, oh, I need something a lot stronger than just lavender for this. So I feel like that's what it brings to mind and kind of validates for me, is that yes, these can go toe to toe per se with something like a benzodiazepine. Yeah, I love it. I hope that they come out with a lot more trials such as this. And I know that there are a lot in the works.
Yeah. Actually, I was doing a little background. I was trying to figure out. So I saw that there actually was another trial that they looked at, similar, same product, the Silexan, but they used it against paroxetine.
Okay.
which was also interesting. They did the same idea, the Hamilton anxiety rating chart, and very similar results. They had a placebo arm as well, but the Silexan, the lavender arm, and the paroxetine arm, similar again in efficacy and decreasing anxiety. Because I believe in this trial, what they were kind of talking about was they found that those people that had mixed anxiety and depression, they found that seemed to help a little bit with that as well. And so I guess that's probably the reason why they went to the SSRI, but it's fascinating. It's just I'm just so excited to see that there is wonderful, robust data like this that's coming out there.
I agree. And like I said, I feel confident there'll be more and more. I know that there's more advancements, more technologies, more because you think about something from nature that hasn't been adulterated, or, it's just a pure plant, the essential oil of the plant. It just has so many ways that it can work there. And we're all the time discovering different ways that essential oils can benefit, because when you take an essential oil internally, the fact that it's going to do what your body is going to support your body in coming back to homeostasis. So you think about, okay, using lavender for anxiety, but what else is it helping with is always, it's kind of like thinking about it like side benefits versus side effects. So I think not only does it have very little side effects that you can experience, that you could mark down or whatnot, but I just think there's a lot of side benefits that we might not even know are happening when we take something like an essential oil, because it is so complex.
Yeah, I agree. There's so many, phytochemicals and polyphenols and all these like really amazing sciencey, really cool stuff that are all in essential oils. And they really just don't know how all of these have the effects that they do, but we know that they do. They have wonderful, amazing effects, particularly on mood. I know
definitely.
for myself, for certain, I put that citrus oil in my diffuser and I just like feel amazing, uplifted all day long.
Yeah.
And I know that, is not just psychosomatic, right?
Oh, definitely not. And just speaking to pharmacists, I know that we went through organic chemistry and like all these different science type classes, but that really is what essential oil chemistry is based off of. It's organic chemistry. So I just, that I loved that part of learning and looking at all these different structures and, this affects this part of your body. And it's really neat. It took me back to my pharmacy school days. And I just think, when I look at the roots of pharmacy, it really did come from the plants. And we know that so many medications are derived from plants that they find in nature, and they're synthesized obviously for different prescription medications. But I just love that we can use things from nature, and there are very little side effects related to that. And we can have really amazing outcomes, just like is showed in the study.
So if someone was listening to our podcast today and they heard the amazing results that essentially from this study that lavender oil in this product formulation is equally efficacious in treating anxiety compared to lorazepam, a benzodiazepine, what kind of what would you suggest to this person if, say, maybe they have this kind of generalized anxiety? Maybe it's not bad enough that it's technically been diagnosed yet, but yeah, we've had a rough couple of years. Everybody's feeling a little bit of anxiety right now. Based on the information from this study, what would you tell that person?
I would just say that it's, I know that we are so resilient. Our body is so resilient. It's wonderfully made. God made our bodies to withstand a lot. But the fact that it can only do that for so long before you're going to start seeing some other things pop up, I just think it's a really great idea to think like, how can I support my body and not always feel like I have to deal with things? And this is really one of the things that I loved after I kind of discovered essential oils, was that I didn't really want to take prescription medications, even though I'm a pharmacist, or really OTCs, right? I kind of just tried to dodge them whenever I could and just dealt with things. But you might could relate to that or not, but I just love that I could I now had these tools that I could use to support my body and just to help it come back to homeostasis a little sooner, right? A little quicker versus just staying in these stress responses that, again, I know that's a whole other conversation, but that really can wreak havoc on your body over time. So I would just say be open to more support. Obviously, we know that movement and sunlight and diet, and there's so many other supports, but this is just one more tool in your toolbox that you can use to support your body. And I think you'll be pleasantly surprised that this is it's a powerful tool to use.
I completely agree. Yeah, I I am a burnout survivor is kind of what I call
Well,
myself
you think
now.
about the healthcare industry. I mean,
Right.
how many people could raise their hand there? A lot,
Right.
the majority. Yeah.
Yeah. And I think the thing that I have noticed too is that by adding on these holistic tools that I am now able to understand in myself when I am becoming out of balance faster
Yes.
than I used to be. So before it got to the point when I was just like sitting in a corner sobbing because
Mhm.
everything was so overwhelming. But
Yeah.
now I get to a point where I'm like, oh, okay, I'm starting to feel a little anxious. I'm starting to
Mhm.
feel a little overwhelmed. What do I need to do? What are the things that are in my toolbox to help me be able to overcome these types of issues that are going on? And is that journaling? Is
Mhm.
that some sort of, herbal tea that I need, some sort of, herbal ally in that way? And I
Mhm.
believe essential oils are also part of that as well.
Yeah. I agree. It's not that we can eliminate all stress. That's really not the goal because it's just not possible.
Mhm.
And especially with people in the healthcare industry, it's like I think there's a lot of pride there sometimes in the fact that we can just keep going and we can do it and we can pick up that extra shift and we can, and I used to definitely pride myself on like being a amazing multitasker and like I could just get things done as like quicker than others around me. And definitely there was some pride there, but there was also some burnout there over time. So I definitely love the idea of just being more aware of how you're feeling versus just kind of stuffing it down. Is probably the first the first step in this whole thing of just trying to honor our bodies and give them what they need in the moment. And because we all want them to perform as they were intended, right? We don't really want these symptoms that we feel, whether it be anxiety or headaches or fatigue, whatever. So I just think we have to start with honoring, what it's asking of us and really listening.
And I think too, I've realized in myself too that, there have been times when you just feel bad for a really long time and then you just think that that's normal.
Yes, definitely. Yeah, that's what happens over time, right?
Yeah. You're like, and so then when you start to feel better, then you go to yourself, why on earth did I wait this long to do the things that I know that I need to get to the place to be, right?
Yeah.
And then you start kind of doing that, kicking yourself in the, oh, I should have known better sort of thing. But this
Well,
is all, it's all within your own time, right? All of this
yeah.
that you have to learn the things that work the best for you personally. I
Mhm.
think that's the other part of this is, for us that work in healthcare, we have guidelines and we have these things that help us treat populations of people. But
Mhm.
yet we kind of forget that each individual in front of us is a human individual person on their own journey, dealing with their own things. And that complicates and makes life more interesting
Yeah.
in terms of how we help these people as well.
Definitely. Yeah. And that to me, I'm very thankful for the medical system, but that is definitely a flaw that it has is that they don't necessarily take the individual in their their whole looking at the whole person into consideration. So I do think pharmacists can come in there because we do have a great relationship with the clients or the patients that we see, and just try to help them and guide them the best that we can, right, for
Mhm.
their for them as an individual.
Yeah.
Yeah. And one more thought that I had while you were talking is that if you are going at such a high pace and high capacity, which we're called to now, those in healthcare are really called to that. Your body is going to need extra support. Like I don't care who you are, it's just going to need extra support to be able to withstand that, right? I mean, hopefully it won't be like that forever. There might be just seasons that are a little bit higher output, but just realize that your body's going to need extra rest and it's going to need extra support by maybe things like essential oils or other supplements, or just diet plays a big part in this as well. And so I just think that's important at any rate to kind of take into consideration.
Yes, 100%. Yes.
Yeah.
And I think that that's a great ending to our discussion today, because it's so, so true.
Mm-hmm.
And so I actually was able to find the product, this Silexan, that is in the US. So it is produced under the name of Calm Aid by Nature's Way. That is the product that is available in the States. I looked it up. It's like $20 for 30 caplets or whatnot. So not super expensive. Definitely worth a try if you feel that you are open to it. So we'll make sure to put that link in the show notes as well. But I just want to thank you so much, Kari, today for discussing lavender essential oil and how we can use it to better help with our anxiety. So I appreciate you so much for coming on.
It's my pleasure. It's a great conversation.